all parents are members. We do ask you to register on the website, but you don't have to pay a membership fee or anything to be a member. We're just, Susan, you want to repeat what we're voting for?
Yes, we're just on the motion to start. So we have never used this particular voting before. It's part of the new upgrade to Zoom. So we're trying it on something that really doesn't matter to work out all the bugs.
We just motion to open the meeting. Thank you, Lauren. Yeah, go ahead. Give it a shot.
And yes, somebody skipped the poll already. And if you want to be a member, there's no dues. In fact, our bylaws, which we'll talk about in a few minutes, specifically say we cannot charge dues. So all you have to do is go to the Vanguardian website and put your information in the directory. That's how you sign up for PTO. And yes, you do have power over what shows to other people. So you don't need to worry that you are putting your family information out there for anybody to find.
Okay, tools icon at the bottom of the screen, not seeing it.
Georgie, you're saying you're not able to see it?
Yeah, I can't see a polls icon. I see a reaction, a record, a share screen, a chat, a participants, and am I looking at the wrong place?
Oh, interesting. See one down at the very bottom, like bottom central. But since I am disallowed from voting, I see the poll, but I don't see any of the buttons.
Yeah, for me, it looks out. Actually, I can share my screen.
After I voted in the poll, I don't see the icon anymore either.
Oh, once you vote, it goes away.
Did I vote? Because I something came up that said, "Are you a PTO member?" And I said yes. And was that it? Was that the poll?
No.
Okay.
I mean, that's the first part of the question.
But then it
So
didn't
maybe-
go to anything else. So maybe it just, I somehow canceled it. I'm not sure. I mean, we don't have to, I don't.
Okay, well, we'll try it again for something low stakes. Okay. Why don't I end the poll? So we've got a majority yes, 14 out of 16 no nos, and 2 abstain.
Okay. Okay.
And then I just shared the results. Can you guys see that?
Yes, I can
Yes.
see it.
I see it. Mm-hmm.
Okay.
Okay. I am taking a minute to get us live on Facebook, and then so Maria, can you tell us how did the poll work? Is that okay? What do we, well, we can fine tune later what we need to do for next time. But what's the feedback on that, y'all?
Easy.
Okay.
Yeah, I think especially once everyone gets used to it, and also it's really obvious that Michelle does a lot because
Yes.
we're kind of truncated trying to admit people from the waiting room while also trying to conduct the meeting. So
Yeah.
I think once we get used to doing everything, we'll be in better shape.
Okay, and there's somebody I recognize. All right, Mr. Moss, thank you for bearing with us and giving that a try, everybody. When it doesn't really matter, that's when we try things out, right? So Mr. Moss, can you tell us a little bit about this fifth grading period?
So sure. Good evening, everybody, and thank you for joining us tonight. Now that we are in the fifth grading cycle out of 6, this is pretty much, I guess, for the spring semester, the most lengthy grading cycle where we have the most instructional days. Given some testing, of course, we have the STAR EOC test for English upcoming less than 2 weeks from now. We have pretty much about the same amount of students, including some new students who are reporting to campus in person. As an update regarding our budget, we received our budget pretty much at the beginning of March. And it seems like every year the district actually cuts off funding earlier and earlier. So we do have some expenditures that we are attempting to finalize and actually receive goods as quickly as we possibly can. There's a rumor that maybe budget funding will cut off sometime maybe in April. So we definitely want to make sure that we have all of our goods in place. So for example, one of the major items that we're looking at is an upgrade to our technology on campus in the form of smart televisions that would replace the current interactive whiteboards that we currently have. These were actually new items when we moved into the facility in 2012, and we were considered a state-of-the-art facility. But now actually new campuses are leaning more towards the smart televisions, which really kind of run circles around the interactive whiteboards. The smart TVs have an internal projector, as opposed to what we currently have is with the external projectors. So the clarity is a lot clearer with the pixelation, so on and so forth. And again, the smart TVs kind of run circles around the interactive whiteboards in terms of their capabilities and what they can do. Just to replace a projector for what we currently have runs around $2,000. So this is an investment for next year as well as many years to come. The Shared Decision-Making Committee did approve the smart television. So we're looking at either the 75-inch smart TVs or the 86-inch. And budget-wise, I think I'm leaning more towards the 75-inch, and that will enable us to accomplish even more with some of our other needs on campus, which includes increased security cameras that will cover additional areas of campus. Also, all of the teachers' instructional needs, and also some field improvements or improvements to the athletic fields, which brings me to another issue that our PTO president, as well as some of our community members, including Neartown Little League, they're partnering with us to address some of the dog issues that we have on campus. So after school hours, many of you already know, we remain open, or we actually open our fields to the public. We want to be inviting to our neighbors. But unfortunately, some of them are not as respectful for our grounds. Dogs are supposed to be leashed, and unfortunately, many of them are not, and they're not controlled by their pet owners. And the worst part is that our students who have physical education outside, or if they participate in a UIL activity on the field, sometimes have to dodge dog excrement as if they're landmines. So we're trying to come up with a partnership with the city in order to address that. Neartown has assisted us with additional signage, which is sometimes ignored. I would hate to think that we have to block or prevent our neighbors from participating on the field, but that would be kind of an extreme situation. I'm not totally against it, but again, we want to work first with our partners and with our neighbors to see if we can kind of get this under control. A bit of good news is that as of today, out of the candidates that we interviewed for the nurse position, we actually do have a nurse that has been approved by HISD, and so she will come aboard starting April the 5th, which is the beginning of our pay period. Her name is Shannon, and I've forgotten her last name, unfortunately, but she comes to us from one of the hospitals in Houston. And not only will she work with us full time, but I believe she'll continue working with the Houston hospitals, maybe on the weekend. So we're very delighted to have her. And before the call is up, I will remember her last name. Ms. Hawes mentioned the information that was distributed today in regards to the STAR EOC exams. So just as a reminder, all of the STAR end of course exams, or EOCs, were waived for last year. They are not waived for this year, however. We will have our safety protocols for all of our students who are comfortable coming to school in order to take the STAR EOC exams. And students or student desk will be spaced at least 6 feet apart, no more than 10 or 11 in a classroom. We had great success and a great turnout and participation and attendance for the PSAT as well as the SAT exams. So if your students participated in that, our freshmen, sophomores, and juniors, it will be pretty much the same situation. So if you were comfortable sending your students for the PSAT and the SAT, the same guidelines will be followed for the STAR EOC exams. And as a reminder, the governor may have waived persons wearing masks, but HISD has not. So as a reminder, every day that students come to class, they are required to wear their mask, not only on the bus if they utilize HISD transportation, but at all times on campus, with the exception of lunchtime, so that they can eat. But we will also enforce the social distancing with 6 feet apart. And then we will also be surveying students in terms of what they would like to see regarding improvements to the physical campus. So I believe that will take place on one of the next even days when we have advocacy. So, and I don't remember if that's actually tomorrow or on Tuesday of next week. Also, as a reminder, next week, Monday and Friday are holidays. Monday is the Chavez Huerta observation. And of course, Friday is the spring holiday that observes Passover as well as Good Friday. And then once we return the following week, we do have on Tuesday the STAR exam for English 1 for freshmen, and then on Thursday, the STAR exam for English 2 for sophomores. And then last but not least, today we had a fantastic luncheon sponsored by the PTO for all employees. And I wish I could tell you all of the accolades and superlatives that I heard from employees on what a wonderful luncheon that it was. I'm on a very special diet during Lent. And I don't think I've ever had eggplant Parmesan, or as hard as that is to believe. And so I ordered that, and it was absolutely fantastic. So kudos to our PTO and the subcommittee that runs it. Thank you so much.
Alex, are you here? I don't know if she's here. She said she was coming, but Alex Ramirez Urkel is the parent who is in charge of the teacher appreciation lunches. And if you're here, thank you very much.
Bravo.
Okay, anything else, Mr. Moss?
That's it for me.
Okay, I'll step in. Let's see, what time is it? Yeah, quarter after. So you all probably know that HISD, we had the interesting news that our interim superintendent was offered a full-time position in a district in Missouri and took it. So our superintendent search has to begin in earnest. There's a lot of politics around that I won't get into. But I can say that there are some meetings this week asking for our feedback as parents. There's a link to them at the very least on Carnegie's PTO and community Facebook. There should be a link from the school district website, and our trustee, Judith Cruz, has also sent letters to everybody who's on her mailing list. If you need that information, please let us know. I believe there's one more set of meetings tomorrow. I've attended one. It was a very positive experience, and they have an outside firm coming in to do these kind of feedback sessions. So that's going on, and please take part. We also have, we're being asked for feedback on what's called HISD wants to become a district of innovation, OI. And I went to a meeting on behalf for this process back in December and reported back to Mr. Moss about it. He says that he hasn't heard much since then, so that it was fine for me, what I had known. There are three things that HISD wants to change. Basically, what this allows a district to do is apply for specific changes. And when I went to this meeting, my personal concern was that becoming a district of innovation would mean that we could just throw all the rules out the window and do whatever we want. That does not seem to be the case. They have three specific things that the district is concerned about, and apparently if they want to change anything after the fact, they have to go through the whole process all over again. So that should be a daunting change. The three things that they're concerned about are they want a different start, which does affect Carnegie because it affects all students. It would mean there's more instructional days added to the year. They want different qualifications for career and training education. That really doesn't affect Carnegie because we don't generally offer CTE classes. Although if you have a student at a more comprehensive high school, that might affect some of the teachers who would be hired in that format. And they're also wanting to change, which probably means lower the state mandated minimum attendance rate of 90% to pass the year. That was the one thing that I was concerned about, and that the people running the feedback session didn't have concrete information on exactly what that meant. Did that mean you need to be here 85% of the time or 50% of the time or something in between? That was the unanswered question. But a lot of this is stuff that doesn't necessarily directly affect students. We need to keep an eye on it. There is feedback. There was a meeting earlier this evening. Unfortunately, that has since gone, but that is something you could definitely contact our trustee about if you have questions. And then last thing I think that I'll discuss, although I always jump in, is went through that pain with the little poll at the beginning of the meeting was because next month, PTO Executive Board will present to you a set of potential changes in the PTO laws for you to vote up or down. Because the Executive Board cannot do that unilaterally. It has to be put to the general membership. And we are required to post it for public viewing no less than 2 weeks before the meeting at which it would be voted on. So that means no later than April 1st. Of PTO bylaws would be posted on the PTO website. The current bylaws are also posted on the PTO website, although they take a little digging to find. They're under documents and forms. And the reason that we're doing this is the current bylaws were written in 2007. A lot has changed since then. Nobody had ever heard of Zoom. Nobody had ever heard of Twitter, I don't think. We had websites and emails and, okay. I'm going to break. Ms. Schmidt, who is on the District Advisory Committee, is that right? Okay, says that changes would not require going through the whole process again, and that concerns about throwing other rules is very valid. Okay, that's good to know. That's not what I was told at the time. So thank you for that information. That's good to know. And that's going back to the District of Innovation issues. about bylaws. A lot has changed, and Carnegie is a much bigger school. In 2012, when we moved into this building, we had what, Mr. Moss, 175 students. That's about the size of Carnegie's current senior class.
Correct.
And so the current PTO bylaws are for a much smaller school. They put a lot of pressure, is not quite the right word, but a lot of work on the PTO cabinet or executive board. And even though there's a committee structure outlined, when we went through it line by line, there were so many things that said, you know, and such is appointed by the president. Well, not only does that put too much power vested in one person, I like people, and I don't know that many good people. So that's a very poor way to get volunteers to help our. Are really the things that we're looking at changing, or then that's the reason that we want to make these changes, and why that's important, and why we went through the pain of learning how to run a poll so we could get this meeting started. So next month, when it matters, we know what we're doing. Ms. Chen, who is on the meeting, Ms. Chen is one of our math teachers. If you haven't met her, she's here under her first name of Stephanie. And if we would like to hear from Ms. Schmidt, she can ask Ms. Schmidt to join. Do you need me to send Ms. Schmidt the link to join? No, she's got it? Okay. Okay, thank you. So yes, please. In the meantime, though, and we wouldn't ask her to spend very much time, probably just a couple minutes. In the meantime, I think I'm done, and we can go on to the Vice President Communications report.
Can you hear me? Okay. So I just wanted to put in a plug. My name is Maria Calzada, and I am the VP of Communications. Right now, we are trying our best to get out to everyone in all the different ways that people are getting information from the PTO, through the website, through Facebook and Twitter, Instagram, the newsletter, YouTube is not being kept up, but it does exist, through the Google Calendar, call out. Thank you, Mr. Moss. And we really could use some help. And I say we, like I have a committee, but I really don't, and I would love one. So this is a call out for help. If you're at all interested in even doing a small part of that, I would really appreciate it. If you're thinking about maybe helping next year, that would also be fantastic. Things that we would be super excited about is just anyone who has a little bit of time to do something small, like be the liaison with school groups, or with administration, or with outside groups like HIST. Any small part that would help us communicate better with teachers and students and parents. Because right now it's kind of a lot, and I'd like to do it better. So if you're interested, please get in touch with me. My email is communications@cvhspto.org, and we'll put that in the chat. Or you can go to our website at any time, vanguardian.org. And so that's my main plug, is that if anybody wants to help with any aspect of communications, I'd appreciate it.
Sure, I had to work on unmuting myself. Thank you, Maria. So Maria is in charge, as she said, of the newsletter and the website and Facebook feed. And if anybody is interested in taking over one of those functions, she'd really appreciate it. I see that Ms. Schmidt is here. Ms. Schmidt is, well, my daughter has her for Human Geo, so I know her as our AP Human Geo teacher, but she also serves some committee functions, including serving as Carnegie's representative on the District Advisory Committee. So Ms. Schmidt, can you quickly sum up for us what you've heard about this District of Innovation issue?
It's actually more than Carnegie. It's one of the teacher representatives, so we're voted.
Okay.
So I just want to, it's hot off the press actually. So I came from the meeting where we heard public comments and we voted, and the vote came through 2 minutes ago. And DAC, District Advisory Committee, voted no, not to advance District of Innovation plan. So as the state of Texas, it's required to receive the approval of DAC to move to the board for consideration, and it has been vetoed. But with that being said, if there were any questions about it, I can absolutely try and answer them, because what may happen is the district may try to continuously keep going back to DOI, but as of right now, it is not an option. I'm very excited, actually.
Okay, that is very valuable information. Thank you. Thank you for coming in. We appreciate it. So for right now, that's dead in the water, and you can just remember all the things that we talked about and know that it'll probably come back.
Yeah.
Is that right? Okay.
It is a possibility, but they'd have to go through by law, they would have to go through the entire process again, and then resubmit it to the District Advisory Committee. There were 3 exemptions that HISD were considering, and one had to do with earlier start dates, which is very enticing. However, once the DOI process is triggered or adopted, so we had 3 exemptions: earlier start date, students in their desk, like students not having to be in the classroom. Right now it says 90% of the time, an exemption from that, and then also an exemption from having certified teachers teach CTE. However, that exemption actually was not having certified teachers teach classes, and HISD said, oh, we'll just keep it to CTE. The concern is that it gave very broad powers to the school district board and to the superintendent, who again is not known because of the search process. And so it was vetoed. And yeah, sorry, I'm just really excited right now.
Ms. Schmidt, I can see that there's a question asking, what does that mean in layman's terms? So what can Mr. Hurish, is that right? Can you be a little more specific as to exactly what you were asking for clarification on?
Sorry,
Sure, Hersey like Jersey. Hey, Ms. Schmidt.
Hi.
Yeah, I just, with all the acronyms, and I'm kind of late, just what does all that mean and why is it exciting?
Yes, I'm sorry. I try to be good about acronyms. So District Advisory Committee is required by the state law, and it has elected officials from staff and teachers, but then it also has members who are appointed by the school board. District of Innovation is an exception that occurs that allows for a district to not have to abide by certain laws. So let's say there is a law right now that requires schools not to go back until like the 3rd week in August, and that's on the books. What DOI does is it gives a district an exemption from certain laws that would normally just guide education in general. A lot of school districts are actually districts of innovation. Like it can be a good tool because it gives more local governance. The concern with HISD and the process that they were using for District of Innovation so that they can be exempt from certain laws is that they didn't put parameters on it, or a lot of very strong parameters on it, which could give them the potential to say, okay, well, now we're going to be exempt from this other law. And some of these laws may include protections for teachers, such as their off periods. I know it's the selfish perspective of teachers, but like taking away their off periods. Right now, the biggest concern is like, yes, we do need CTE, and CTE is career and technical education. And we get extra funding from the state if we have career and technical education classes. And the thought is, if we make it so that we don't have teachers who are required to be certified by the state, we can put them in the classroom like professionals in the field. But again, the concern was that in theory, HISD says it's going to do it this way, but they could potentially expand it to non-CTE classes to be like English classes or, you know, physical education classes. Me saying it's a good thing has to do with my bias as a teacher on the committee and just having been part of the process and kind of how it was pushed through. Like there was an assumption by the board that this was going to happen. Like HISD admin often talk to the constituents who are part of the process as this is going to happen, as opposed to let's consider the pros and cons associated with it. So that's a little bit of background on it. Sorry about that.
Thanks. Thank you.
Sorry, I'm looking at the comments. Hello, everybody. Sorry if I don't get to see you that often in person. Yes, and the mention about Lake Travis, absolutely, there are several districts of innovations, except they tend to be a lot tighter in their language and how they're enacted. And I put this out there too, is that there are some considerations about our board in general, and that we may face a TEA takeover. And one of the biggest questions actually was, if we trigger district of innovation and we're taken over by a board of managers, then can the board of managers use that process to enact a lot of policies that also could come back to kind of hurt our students in general? So, sorry, thanks.
Thank you. Wow, I did not see that topic coming. So thank you very much. And there is one last question. Are there certain laws that cannot be changed or are exempt from any district of innovation process?
I think that there may be, in terms of like which ones can't specifically. It probably has to do with some of the funding formulas, but it's not that tight. Like it's a very broad statute. And the reason why the statute kind of came through the legislature is to give the Texas legislature a way for school districts to get around laws and allow school districts to act more as almost like privatized charters in competition with them. And so that was kind of their mindset behind it. But I'm not sure about the certain laws though. I can check and see if there's certain laws that can't be changed or exempted.
Okay.
Yes, actually federal versus state would probably be the best example. Yeah.
Okay. Does anybody else have any other questions? Thank you. I really did not see this topic coming as a topic of interest. I figured it was bureaucracy. So thanks for being here to make it clear for us. Okay, I don't see anything else popping up in the chat. Georgie, sorry, are you willing and ready to give your volunteers report?
Sure. It's going to be short and sweet. Basically, kind of tagging along with Maria, we are trying to figure out, and Susan, what volunteers we actually need, and we need more of them. And we want to make it easier to volunteer for the PTO. So we've kind of done a big organizational chart. We have some real immediate needs, though. And the main one is that we need a treasurer for next year, someone who would be willing to be a treasurer. Having some familiarity with QuickBooks is a plus, but not a necessity. There's more about it on the website. And if you are at all interested or think, oh yes, I want to come to executive board meetings with these lovely and entertaining ladies, then please sign up. And that we can get that person started with our current treasurer, Helen, because there's just a little more to learn with that position. It really, as Helen will say, is not a big complicated thing, but it does require kind of knowing what you're doing with all the different budgets, making a budget and all of that. So if anybody thinks like this is right up my alley, please send me an email. It's volunteers@CVHS PTO.org, and I'll put that in the chat, or Susan will, so you can let me know. Also, if you are thinking like, wow, there are some, we're getting a nominating committee together and looking forward towards you know, who might be part of the executive board next year, who would like to be the head of a committee. We have lots of committee head positions opening up. And if you're interested in kind of getting more familiar with how to get involved with the PTO on that executive board committee head level, come to our executive board meetings. You'll realize maybe there does need to be, maybe they can be a little bit boring, but you'll also get a great idea of how kind of things work. And we're not an exclusive group. We want to be an inclusive group. So we want to let you know that that's always an option. Just show up at our executive board meetings, which are the third Tuesday of every month, and kind of see what it's all about, get some more information. And I'm also going to put something up on the website and try and get it in the newsletter about all the different committee head positions that will be opening up in the coming school year that we're going to need help with. Okay, that's it. Thank you very much.
Great, thank you, Georgie. Yeah, generally the executive board turns over in May, and the year starts more or less effective June 1st or after graduation. By the way, you don't have to be female to be on the executive board. Dads, you're eligible too. What else? Oh, social chair report. Jamie Turner could not be here tonight, so she asked me to give her report, which was we managed to have class movie nights while dark was still coming early. We're very, very thankful to the Wolf family. Jake and Tinley's parents had an outdoor movie screen that they lent to the school. And we set it up in the parking garage so the kids could watch outdoor movies and then sorted them by class. But I think the student council showed up to help with every event. So cheers to them, even though I think the students generally aren't here tonight. And we're hoping to do an online talent show because Carnegie usually has a live talent show sometime during the year, and that will be probably the next project. And the senior class typically has activities going on. I think they have anything to announce at this particular time, but just keep your ears open if you have a senior. And Monica Balakrishnan, are you here? Okay, I see you.
Yes.
All right. Monica is a junior, is that right?
Yes, ma'am.
At CVHS. And segue into our program, she is part of a project at school that is about vaccines, and she asked for a couple minutes tonight to talk with us about it.
Yes, I did. So first of all, good evening, everyone. My name is Monica Balakrishnan, and as Ms. Haas said, I'm a junior at CVHS. And before I get started, I hope that everyone and their families are doing well. And of course, during this time. And in addition, I would like to thank Ms. Haas and the PTO for allowing me to come and speak today. Also, as a CVHS student, I really appreciate all the work that CVHS administration and staff, of course, all my teachers, as well as the PTO have really done to help segue and transition into this crazy time. And I know that we as students really appreciate all the work that you've done. And so thank you very much for everyone's hard work. So without further ado, I'd like to introduce Teens for Vaccines. So Teens for Vaccines is a free service created to help elderly people age 65 and above who are in need to schedule vaccine appointments. I've started this initiative with the help of Madeline Sue, a fellow junior at CVHS, and we also have a group of volunteers from CVHS as well as other schools contributing in this service as well. It actually all started, ironically enough, when I was helping an elderly person out try to schedule a vaccine appointment. And I came to know actually how tedious this process was. As you all might be aware, the information to book an appointment is all available online. But the problem is that it's available in multiple places. And so in shortcoming, you need to know A, where to look, and B, even then you need to be vigilant about actually checking it. And so to help with this process, we did some research and compiled the sites of hospitals, as well as clinical care sites, vaccine hubs, and we constantly monitor and update the site list so that we can have updated information that we then use. In addition, we have 2 levels of service where we give people a choice on whether they want a comprehensive list of sites for them to actually book their own appointment. But we also, because we're targeting elderly, we have an option where we will actually book the appointment for them. And so as tech-savvy high schoolers, we really want to help bridge the gap of information by using knowledge we've gained and gotten from research. We want to be able to help our community at large. And so our main goal is to really make as much of an impact as possible. And of course, to society, hopefully be able to help everyone get out of this as soon as possible. And so we'd love to extend our service to the CVHS community as well. And so And please, if you know anybody who'd be interested in the service, ask them to sign up at our website. Thankfully, Ms. Haas has put this in the chat. All they have to do is just go there and they'll be directed. It's pretty straightforward. And another thing is we would love, there's over 43 people on this meeting. And so through you guys' different platforms, social media, please feel free to spread the word about this. And in any way, shape, or form, that would be much appreciated. And short, sweet, to the point, thank you so much for your time this evening. And I really, really appreciate everyone listening tonight. Yes, I am.
So thank you very much for coming to talk to us. If you know somebody who might benefit from this service, it's teensforvaccine.org, and it is in the chat. Is it vaccine or vaccine?
Vaccine, yeah. It's because we're targeting only the COVID-19 vaccine, so it's not plural.
One
but
vaccine.
yeah.
Okay.
Yeah.
All right. And I did remember one more kind of bureaucratic thing. The district sent out a survey about next year's academic calendar, and they would like feedback by the end of the week. I think it's on the district website, and I think I posted it in the PTO Facebook as well. The basic question is, all week for Thanksgiving with a few days fewer at the end of the year, or a 3-day Thanksgiving break week off for Thanksgiving and then school goes a little longer, or 3 days for Thanksgiving and then school goes a little shorter. But please do take a sharp look at the calendar, especially if you have this holiday or other time off that is important to you. Please take a look and offer back. That's open to all of us. And now we are ready for our program. A little past time. So doctors, thank you for your patience. I see we have Vijay Jotwani with us, who is the parent of a Carnegie student. Valentina Hoyos, Dr. Jill Weatherhead, I see you too, and Dr. Pratik Kulkarni, I believe, and our own Maria Calzada is going to moderate because she also has an infectious disease health background. So we look forward to hearing what you all have to tell us. Thank you very much for being here. Thank you for through a little bit of bureaucracy and internal discussion, and welcome.
Okay, good evening. So did we let everybody in? Are all our presenters here?
I see everyone.
You're able to see everyone? Okay. So I'm going to try to share a screen. Let's see if I can do it in less than a minute. Is everyone able to see that? Susan?
Sorry, I was muted. Yes, I see it.
Okay, can you hear me?
Yes, better now.
Okay, okay. I got a text that said that my mic was quiet. Okay. All right, so as Susan said, we've got excellent physicians with us today, and I want to thank our parent, Dr., who's also a physician, a hematologist, oncologist, Dr. Jotwani, who said this isn't her wheelhouse, so she's not going to present, but she is married to Dr. Vijay Jotwani from Houston Methodist. Is board certified and fellowship trained in primary care and sports medicine. We also have Dr. Jill Weatherhead, who's an assistant professor in tropical medicine and infectious disease. Sorry, I'm losing my voice. We have Dr. Kulkarni, who is also with Baylor and is an infectious disease specialist, and Dr. Valentina Hoyos, who is an assistant professor and at the Center for Cell and Gene Therapy, also the Baylor College of Medicine. If I messed up anybody's credentials, please correct me. I thought that we'd go ahead and start a little bit with everybody making a short introduction as to whether or not they work with children, because I'm a PA in infectious disease and I don't deal with children at all. So I know for me specifically, I'm very interested to hear about that topic, and considering we're a PTO, I'd like to hear what you have to say. Anyone want to start?
I can get started. I'm Jill Weatherhead. It's nice to meet everybody. I am I'm adult and pediatric trained physician. I specialize in both adult and pediatric infectious diseases. So I work through Baylor College of Medicine, but I see patients within Harris Health System on the adult side, and then on the ped side, I see kids at Texas Children's Hospital.
Good evening, everybody. My name is Pradeep Kulkarni. Thanks again to CVHS and Susan and Maria. Thank you all very, very much for the invitation to sort of be with you this evening. We really appreciate it. I'm also a faculty at Baylor College of Medicine. Actually, I also trained in internal medicine and pediatrics. Coincidentally, Dr. Weatherhead and I started out as interns together many, many years ago. So we've known each other a long time. And I also completed additional training in infectious diseases, specifically in adults. And so I'm happy to be here and happy to answer any questions.
I would also say that Dr. Hoyos also trained with Dr. Kulkarni and I as well. So we were all interns together.
Yes, lots of fun.
Go ahead.
And I'm Dr. Jatwani. I also work with children. My practice is mostly sports medicine, but in my background in family medicine, a big part of my role has been helping guide some of the teams I work with, like the Astros and the Rice University teams, through the COVID pandemic. And so that includes working with young adults, but also with children. And so very excited that we're going to see the vaccine open up, the Pfizer one, to our athletes 16 and up. And, you know, for our Astros team, who's going to fly back to Houston and get vaccinated soon. So I think we're all excited for the beginning of the end of the pandemic coming now with the vaccine.
And my name is Valentina Hoyos, and I only see adult patients. I actually am an oncologist, so I see patients with breast cancer. And you might think, what does that have to do with this? Well, I work on what are called immunotherapies, so trying to make the patient's own immune system attack cancer. So I know a lot about immunology, and therefore I know very well how these vaccines work. And that's why I was asked to come today.
And Aparna, we see that you have joined. Thank you very much for helping set this all up and for rounding up your friends, basically. It's nice to hear from a kind of a working group of people who all know one another. Welcome.
Yes, thank you so much. So one of the questions that a lot of people have right now is, you know, because the mRNA vaccines came out first with Pfizer and Moderna, and everyone heard the numbers, you know, the 90%, 95%, 97% efficacy. There's been a lot of skepticism with the Johnson & Johnson vaccine that came out because the difference in efficacy. And then now with the AstraZeneca vaccine and a little bit of walking back on the initial data. Talk to us about why or why not people should be paying attention to that, and how it relates to our vaccination of our soon-to-be young adults. Does anyone have a take?
I guess I can get started. So, there's 3 vaccines that are currently what's called FDA EUA or emergency use authorization here in the United States so far. And certainly there's some in the pipeline to be approved here, most likely very soon. And those are, as Maria mentioned, are the 2 mRNA vaccines, Pfizer and Moderna, that received their FDA EUA back in December. And then most recently, Johnson & Johnson, which is a viral vector vaccine. So the technology is just a little bit different. And what they found was that within all of these trials, the efficacy of these vaccines differ slightly in terms of preventing symptomatic disease, but all of them prevent against severe disease. They prevent against hospitalizations, they prevent against death. And that's really critical when we're thinking about controlling the pandemic, making sure our hospitals have the supplies that it needs, and preventing illness in our population, in our community. And so you'll hear this differences in vaccine efficacy, but it's really important to focus on too what the main goal here is, and that is to make sure people stay safe and they're not getting really sick. And all of these vaccines are going to do that, which is really quite extraordinary that even in a year within this pandemic that we have 3 quite extraordinary vaccines that prevent that severity of disease.
I'll just add a couple of points. I mean, I completely agree with Dr. Weatherhead. I try to keep it simple for everybody I speak to, or if I ever do any interviews or anything, which is whichever vaccine is available to you first, go ahead and get that one. The most important thing is that all of them keep you out of the hospital and prevent you from dying, which is the most important feature. And the faster we can get everybody in the community immunized, the faster we're going to get out of the pandemic. So to keep it simple, whichever vaccine is available to you first, I would suggest to get that one. There is one small sort of subtle difference that I will mention because it's relevant since we're at a high school PTO meeting, which is that the Pfizer vaccine, one of the mRNA vaccines, is licensed for people who are age 16 and older, whereas the Moderna and Johnson & Johnson vaccines are licensed for folks who are 18 years of age or older. So there's a little bit of difference there. The main reason for that is the way the scientific studies were conducted. So it's not anything about safety or something, like that. It's just because they happened to go down a little bit in age when they did the scientific trials for the Pfizer vaccine. So in case if you have, obviously kids who are 16 or 17, they may have to go for the Pfizer vaccine versus if they're 18 or older, they could really get any of the vaccines. That's the only subtle point I wanted to bring up.
We have a question in the chat. Maria, can you see that?
No, because I'd have to have it open.
Oh, okay, that's okay. I'll read it out loud.
I can get that one actually.
Go ahead. Okay, it's, can you explain what a viral vector vaccine is? This is a question from the audience. Does that mean you are being infected with a lesser virus?
Yeah, so that's a great question. And so some of these vaccines are called viral vaccines just because they're packaged like a virus, but in reality, it's not a virus in the sense that it cannot replicate. So even though it can get into the cell, it can't really cause disease because it can't just turn into more viruses that will then go and infect other cells and kill the cells at all. So it's only the reason it's called a vector is it's only made to insert inside just the protein of the COVID-19 so that the immune system will attack that. so that the immune system is kind of primed to recognize that as foreign to the body. And therefore, when the actual COVID comes, then the immune system can attack it and not get sick. But it's not really a virus because it can't, as I said, replicate. And that's the most important thing. It's not an attenuated virus, which is sometimes other vaccines were like that, but not this one. This virus is not able to at all replicate or anything. So does that answer the question?
I think so. Actually, Dr. Flynn, maybe you can answer. So thinking of attenuated viruses that we use sometimes in other vaccines, some of our immunosuppressed patients, like cancer patients that have been treated with chemotherapy, sometimes we tell them to wait or to not get certain vaccinations. In the case of COVID vaccine, are there any restrictions that you're telling your patients?
No, we're recommending that everybody gets the vaccine because of that same reason. The vaccine cannot make the person sick. The only thing that we worry about is that maybe the immune reaction against it won't be as strong as a person that's not on chemotherapy. So we don't know exactly how well it protects people that have a lower immune system, but it's still worth getting it to see. All of our patients are getting it, and we try to give it in between chemotherapy cycles so that the immune system has come back and therefore can get a better reaction.
Very good.
There are several questions coming up in the chat. We will get to every question. We had a list of questions for the presenters as well, and there might be some overlap. What can you tell us about the approval process for the vaccines that are currently being offered? Who approves them and how does that work?
I can maybe start. Basically, all vaccines have to go through 3 stages of testing. We call them phase 1, phase 2, and phase 3 before they can get authorized by the US Food and Drug Administration, FDA. And all 3 of these vaccines, which have gotten emergency use authorization, have gone through these 3 phases. Now, people often ask, well, why did it happen so fast? Because usually vaccines previously, they can take several years to get approval. So there are a couple of reasons for that. One, obviously we're in a pandemic, so people were working more. I mean, they were working on the weekends, getting stuff done faster, getting the paperwork done, pushing it through faster than they would under normal circumstances. So that's one. 2, because of Operation Warp Speed, there was a lot of funding, available to undertake these trials very quickly. So that was another reason for that. But bottom line is all 3 went through all 3 phases. And the final phase, phase 3, is the first couple ones are really to make sure it's sort of overall safe and works reasonably well. The final phase is usually a very big trial that includes tens of thousands of people. So for example, the trial that studied the Pfizer vaccine had about 40,000 people, half of whom got the vaccine. The Moderna trial had about 30,000 people, half of whom got the vaccine. The other half get a placebo because you have to see if it's working. And in those trials, there was no strong adverse safety outcome or anything like that that was detected. So these trials have undergone all the phases, big numbers, I mean, literally tens of thousands of people. And then it's on the basis of that the US FDA gives emergency use authorization for them. And then after they do that, then CDC makes a recommendation about who should get them. And again, for this particular vaccines, the COVID vaccines, it was pretty straightforward. Really, they're recommended for everybody. So that's the kind of overall approval process and how the recommendation gets made at the end. I can certainly expound more if folks have any further questions or if anyone else on the panel has anything else to add.
I just have a little thing to add, and it's that one of the other main reasons why everything was so fast is because of the number of people that were getting COVID. So what they do is they vaccinate some people with placebo, which is not the vaccine, and then the same amount of people get the actual vaccine, and then they follow them and see who gets sick, right? But because of a pandemic, where everybody was getting COVID. So it was much faster to get to those numbers versus other diseases that were not in a pandemic situation. So you have to wait a lot longer for them to actually get the disease to know if the vaccine will protect against it or not.
I also want to just add really quick to hopefully provide some confidence to everybody who's listening, is that these also go through independent review boards as well. So review boards that have nothing to do with the company, they have nothing to do with the FDA, nothing to do with the CDC. They literally get the raw data and they take a look at it and are unbiased. And so with that, you're able to get a really clear understanding of the efficacy and the safety of these vaccines. And I think that's really important, especially as we know people are, we want to get these vaccines out quickly. We want to make sure people get them, but it's really important to understand that there are stop gates that are independent reviewers that took a look at this. And that's what we saw this week play out with the new AstraZeneca vaccine, where that independent review board said, now hold on, wait a minute, this doesn't add up. Let's take a couple steps back and really look at this data and make sure it's safe and make sure it's as efficacious as you say it is. So I hope that gives a little bit more confidence that it's just not being pushed through. There are multiple different sectors that are looking at the data, and many of them are independent of all the major players involved in the development.
So one of the questions that's in the chat that is specific, and can you guys hear me okay? Okay, I'm still at the hospital and I feel like I'm screaming. I'm trying to kind of moderate. Anyways, is regarding allergies. Again, trying to kind of relate to other vaccines that people know about when it comes to eggs and other common food allergies that kids may have. Now that not only the Pfizer vaccine has been okay for 16 and up, but moving forward, we're hoping that we're going to see that these panels start to come out with their studies and loosen up on the guidelines. What is the recommendation or the concerns that people need to be looking at for children and food allergies or any other contraindications?
So right now, the recommendations are people who have underlying food allergies, even non-food allergies that aren't a part of the vaccines are still eligible to get any of the 3 vaccines that have received FDA approval. If you've had an allergy to what's called PEG or polysorbate, which is part of these 2 types of vaccines, and I know I don't, wouldn't know those off the top of your head unless you had a true allergy to those. But if you have allergies to those 2 substances, then it's recommended you don't get the vaccine. But if other food allergies, other contact allergies, those are still okay for you to get the vaccine. What I tell people though is it's important to talk to your primary provider, have a plan in place so that you know the people when you go get vaccinated, they know that you've had some allergies before, just so there's no surprises and it's a controlled environment. But all in all, there really hasn't been a major signal for anything outside of those components of the vaccine. And people who have general food allergies and egg allergies, because there's no egg product within these vaccines, are okay to take them.
Thank you. Do we need to get the vaccine every year? Just talk about boosters. Does anyone want to take that question?
That's a question that has no official answer right now, if I'm going to be very honest. It's a subject of ongoing scientific research right now, how long immunity from the vaccines is going to last. They've only been around for 6 to 9 months or so, since from the time they've been developed and sort of tested in people. It is actively being studied how long antibodies and other components of the immune system last after vaccination. So one possibility is it might end up like the flu shot. You have to get a booster every year. Another possibility is it lasts 5 years or maybe 10 years or something like that. I think it is a little bit unknown currently, but it's being actively investigated. I know there are some concerns sort of floating around about the sort of variants. Maybe I'll just make a brief comment about that. I don't know if one of the questions in the chat sort of referenced it as well. There are about 3 to 5 main variants right now in the United States that are kind of circulating. The predominant one in the Houston area is the so-called UK variant. It has a technical name, but everybody knows of it as the UK variant. For that particular one, the early data suggests that the vaccine should work just fine, actually, against it. And as I tell sort of everybody I can, at this point, there's no strong evidence that in actual people, that there's some proof that the vaccines aren't working against the variants. There's some studies they've done in laboratories and stuff like that that maybe suggest some differences. But right now, it has not been sort of well demonstrated that the vaccines don't cover against the variants in actual people. So they are out there. That is going to be monitored. But all the evidence right now still points to the vaccines being very effective, all of them against all the variants. That may change maybe going forward, but for right now, I guess I want to reassure and encourage people to still get the vaccine.
So we're kind of getting into a situation now where we've got more and more parents that are vaccinated, more grandparents that are vaccinated, and in the household, we have 1 or no children that are vaccinated. What are the recommendations, the official recommendations for interacting not just with other classmates, teachers that may or may not be vaccinated? Hopefully soon everyone will be. What are we supposed to be telling our children is okay now after a year of telling them they can't go anywhere or do anything?
I'm happy to start, and but please fill in anything I forget. So the sort of where this is coming from is about, I would say, 2.5 weeks ago, CDC released new guidelines for what quote unquote fully vaccinated people can do. And I'll sort of briefly summarize the main points. First, I think it's important to say what makes somebody fully vaccinated. The definition of fully vaccinated is you finished all of your dosages of the vaccine. So in the case of Pfizer and Moderna, that's 2 doses. In the case of the Johnson & Johnson vaccine, that's only 1 dose. But when you finished all your doses, then a full 2 weeks after that final dose, after that time, you get the final dose, you wait 2 weeks, then beyond then you're in the zone of being considered fully vaccinated. So that's the definition. Now, what can fully vaccinated people do? So the first one is easy. I'll try to put it out there and make it as straightforward as possible. If you have a group of people, let's say small to medium-sized group, all of them are fully vaccinated. Everybody in the group is fully vaccinated in that category. Then they can meet up in a private setting, like somebody's home, for example, for dinner, without doing physical distancing and having a mask and things like that. If everybody in that setting is fully vaccinated, then they can do that in a private setting. The slightly more complex question is, what kind of interactions can fully vaccinated people have with unvaccinated people? That's a little bit more complicated, but let me try to break down a couple of points. One, when a fully vaccinated person meets with an unvaccinated person, the risk is to the unvaccinated person. It's not really to the fully vaccinated person. That person is protected from the vaccine. So if you have somebody is fully vaccinated, they can theoretically meet with one other household where not everybody else in that other household is fully vaccinated. If amongst the unvaccinated people, let's say, young children, for example, because they're not eligible for the vaccine, so by definition, they're unvaccinated. But if you have fully vaccinated people coming to that house with some people who are not fully vaccinated or who are unvaccinated, that is okay if amongst the unvaccinated people, nobody is at high risk for having a bad outcome from COVID. So who's at high risk for having a bad outcome from COVID? Folks who are older and folks who have underlying medical conditions. So who's at low risk for a bad outcome from COVID are really young, healthy children. So that's why the sort of best example of this is that you have a set of grandparents, they're fully vaccinated, and they come and visit their kids and grandkids. And then let's say the parents are fully vaccinated, but the two young children are not vaccinated. If everyone is feeling fine, that's still considered okay, because the theoretical risk in that situation is to the young children who are not at high risk for having a bad outcome from COVID. So I know that was a little bit, sort of windy, but I hope it made sense, and I'm happy to clarify it. The only other point I wanted to make is that if you start putting multiple households together, the challenge there is then you're going to start putting unvaccinated people with other unvaccinated people. And that's where the real risk of transmission can happen, is when unvaccinated people come together.
Thank you. I think that is actually what that covered the spectrum that we're all kind of dealing with now that people are starting to tiptoe out. Did anyone else want to add anything? Okay. So there was a question regarding what is required for a vaccine to be declared quote unquote safe for teenagers. We've kind of talked about that. I don't know if anyone has anything else to add regarding the safety aspect.
Maybe we could just talk, because I know there's a lot of questions about where we're at with kids and being vaccinated, and that might answer that question a little bit as well. So as Dr. Kulkarni mentioned, for Pfizer, that it's approved for 16 and older, and with Moderna 18 and Johnson & Johnson 18 and older. But both Moderna and Pfizer back in the winter started their vaccine clinical trials for children 12 to 17 years of age. And that was based on the same, it's a phase 3. So they're just extending the trials that they already did in adults with the same dosing, the same schedule, the same follow-up within that 12 to 17 age group, or 12 to 15 age group for the Pfizer. And that trial is actually almost about done. There's predictions to have data available for that age group within the next few weeks, which should give a lot more information to people about how safe this is in children. And the early signal from those trials, per the Pfizer and Moderna, is that they are safe in this age group. And the way they're showing that is they've actually started their next set of trials, which is age 6 months to 11 years. And both Moderna and Pfizer have started those trials. Both had said previously that they were going to wait to get their data from the 12 to 16 age group or 12 to 17 age group. But because of the data they're getting back that looks so promising, they actually have opened up that next age group. So what they're doing is what's called a phase 2-3 study. Looking in comparison to the older kids, they're actually going to look at different dosing in the younger kids to make sure it's truly safe as you get younger. So it's going to be what's called a dose escalation. So they use 2 to 3 different doses, and an age de-escalation. So they're going to move down the age groups from older, 10 to 12 and or 6 to 12, and then 2 to 6, and then 2 and under. And they're going to do that in a phased way to make sure that each dose is safe as you move down the age spectrum. So it is very well planned out. very, very thorough to make sure that these are safe in each of those specific age groups. And that, as I mentioned, for Moderna started about 2 weeks ago, and this week started for Pfizer.
That's super exciting. There is a question regarding whether or not there are active trials for children, and I think we all there are. Are any of you participating in the active trials? Are you actually involved?
I am not, but I do know the investigators on that trial, and I have myself signed my kids up. We haven't been called yet, so hopefully we will. But I have a 3-year-old and a 5-year-old, so I've put them on the wait list right now to get them signed up. So that is available and open at this time, and they are calling people to register.
Someone asked for the NCT number. I don't know what that is.
The clinical trial number.
NIH clinical trial.
NIH. Okay.
I can look that up and see what I can find.
And if we can't get to everything, I'll make an attempt to post some answers or have it in the newsletter. Okay, so it's getting late, so I want to kind of move quickly to one other aspect that's a little bit away from vaccine. How often have you run across the syndrome, I was thinking Kawasaki's, the inflammatory syndrome that we see in children after they get COVID? It went out of my head what it's called.
Yeah, so the MISC.
MISC, yeah.
Yeah, so, it is a rare complication of COVID that was first identified back in the May time period, both in the UK as well as subsequently in New York. And since then, we have seen several cases, including at Texas Children's Hospital. And so it is something that is being monitored. And I can tell you from my experience that when you are diagnosed with COVID through the Texas Children's system, they do monitor you for the next 2 to 4 weeks to make sure that you're not developing any of the symptomatology that is consistent with that syndrome, which are persistent fevers, really actually pretty sick kiddos with a lot of inflammation. So they may have rash, they have conjunctivitis, like I said, that persistent high fevers, and then they can go into organ dysfunction. And this is something that has been studied at Texas Children's Hospital. I'm speaking from that institution, but I'm sure the other pediatric institutions are similar in what they're seeing and how they're treating these diseases. But it has been very well studied at this point, and the outcomes have been very good today. I'm not sure if Dr. Jadwani had seen more being from the sports side of things and having to deal with some of the cardiovascular inflammation consequences from this, but they do tend to be very sick kiddos up front, but tend to recover pretty well.
Yeah, a big part of what we've dealt with on the sports end is looking at the cardiovascular complications of COVID. And I think we're all feeling a lot better about things now that we're moving on to the vaccine phase of the whole pandemic. I think it's important to know that while a lot of my patients have done really well with COVID infections, not gotten significantly ill, had relatively mild courses, similar to a respiratory infection, especially dealing with young, healthy people, there are some rare cases that are really concerning, and I think remind us of how important it is to continue to pay attention to all our mitigation efforts to avoid COVID. And so some of those are inflammation of the heart that can occur with multiple viruses, but was found to be one complication in COVID. Fortunately, we have not dealt with a lot of this overall, although the initial data was pretty scary that we were seeing a lot of heart changes. I think we haven't seen a lot, but there have been rare cases a professional basketball player who passed away 6 months ago or so from COVID in Europe. We also are seeing some persisting symptoms in some of our otherwise healthy people, like loss of smell and some mental issues that have come up post-COVID as well. So I know Methodist, and I'm sure the other hospitals have started setting up clinics to help those people with post-COVID persisting symptoms. And I think that'll be something we'll see a little bit more of in the news as we transition away from a lot of people having acute COVID to some of those long-lasting effects that may have unfortunately come up. So still super important to wear those masks and wash your hands and try to avoid COVID, because even though chances are it might be mild, there are some of these persisting issues that can be significant and bother people for a long time.
Absolutely. So we've got overtime, so I want to be respectful of everyone's time. I really appreciate, I know we all appreciate you guys spending this amount of time with us. This is a unique opportunity, and I'm sure that this video is going to be highly watched on our Facebook page. Let's see if we've got one more question. Dr. Weatherhead already answered it in the chat. Thank you.
And I think earlier up the chat, we had some questions about side effects. I know that there's been a lot of news from Europe lately about the possibility of blood clots being a side effect of the AstraZeneca, but then maybe not. And that got a lot of press. Can you address the issue of side effects? What are they really, if any?
I'll make a couple of comments in general about side effects, and then maybe about the AstraZeneca blood clot issue specifically, which I looked into deeply, and in fact I discussed with Jill, Dr. Weatherhead, about it as well. So let me just talk about overall vaccine safety. They are exceptionally safe vaccines. So I want to emphasize that. As I mentioned, these trials were done with tens of thousands of people, and there was no systematic adverse safety signal in any of the 3 vaccines which have received emergency use authorization. So my main message is that these vaccines are exceptionally safe and efficacious. That's my main take-home message for all of these 3. Now, what people can expect to experience, because a good chunk of people do, is for the 2 or 3 days after getting the vaccine, you can have some things like you feel a little bit tired, your arm hurts, maybe have some joint pain, muscle aches, headache, some things like that. Those kinds of symptoms are not uncommon. And they're usually a little bit worse after the second shot compared to the first shot, typically. But they do go away within a few days, and they're not long lasting. And it's just your immune system actually sort of revving up and responding appropriately to the vaccine. So it's nothing to be concerned about. That's very typical. If it's really bad, you can take some ibuprofen, Tylenol, things like that if it is very bothersome. And then there was a question in the chat about, let's say 5-10 years down the road, could we expect any side effects from these vaccines? Now, obviously, that amount of time simply hasn't passed. But if you look at the history of vaccinology over the last 40 years or so, there hasn't been a situation where somebody got a vaccine and then 5 years later, there was a set of side effects attributable to that vaccine. If you are going to have any side effects from vaccines, they typically come within the first month or something like that, 1 to 2 months. And these vaccines, before they were authorized, they were studied on average for about 2 months in the people who got them, specifically for that reason, to detect any rare side effect. And that wasn't necessarily detected. But the possibility of something 5 or 10 years down the road, at least in the history of vaccinology, has never really been documented as a problem. And then the final point about blood clots in the AstraZeneca vaccine. Okay, so there was some concern that AstraZeneca vaccine was getting widely distributed in Europe, and that a certain number of people getting the vaccine were getting blood clots in their legs or sometimes in their lungs and things like that. Now, it's important to keep in mind some basic concepts about epidemiology, because this confused actually a lot of people, and that's why it got into such a big deal in the press, which is that if you look in the United States, for example, on average, even before COVID, on average, roughly 8,000 people per day die from natural causes in the United States right now. I mean, that was even before COVID, from heart attacks, cancer, stroke, whatever, normal reasons why people pass away. Now suddenly we're going to, or they have other diagnoses like blood clots or whatever other new diagnoses. But now suddenly we're going to vaccinate millions and millions of people. But that base rate of disease happening in the population is going to still keep happening. If you suddenly vaccinate the entire population, still 8,000 people a day are going to die from their natural causes. But that doesn't mean it was the vaccine. That's why you do a controlled trial to see if the people who specifically get the vaccine after a period of time, they develop something specific. So how this relates to the issue with the blood clots is that a bunch of people got vaccines and then a very, very, very tiny number got blood clots. But when they compared to how often blood clots were happening in people in a big population, even before the vaccines, it wasn't any different. So the rate of blood clots happening didn't change after vaccination. It's just that they happened to get a vaccine, maybe a week or 2 weeks before, but it's not changed from the rate at which people were getting blood clots even before the vaccines were rolled out. So I know that was a little bit of long-winded explanation, but I wanted to give the background for why that turned into a concept or a concern that didn't really pan out when you think about it in this sort of epidemiological way. And they had initially put a hold on the AstraZeneca, but then as soon as they analyzed this and saw that the numbers weren't really any higher than they had been even before the vaccine, then they immediately reinstated it and they started using it again.
Yeah, and I'll add to that just as a group of people that in general got vaccinated very early, like around Christmas, I've been astounded at the number of people who it's been months now and everything that happens to them, they're like, oh, it was the vaccine. And one of my nurses who started experiencing some vertigo. The vaccine, it's not the vaccine. So people do have that tendency, like Dr. Kulkarni just said. So making connections where they don't belong. Do we have any more questions we needed to answer to?
Yeah, and if I can just say real quick, I want to thank everyone, like all of my friends, like Susan said, for their time. And if you guys remember, before Nurse Prentice left, she sent out a COVID cartoon, and I wanted to thank my colleague, Dr. Hoyos, because I know my children liked it. I don't know if your high schoolers watched it, but I know Nurse Prentice had it on. And just thanks everyone. I appreciate you just volunteering, and I learned a lot.
If I can just add something, I want to give my thanks. I mean, this was an invaluable presentation. So thank you again to all of the physician panelists.
Thank you for having us.
Yeah, thank you. It was nice to meet everybody.
Thanks again to everybody for the invitation. Thank you all.
Thank you so much. We will probably bother you again one day.
Yeah. Well, hopefully this won't go on too much longer, but we're very appreciative for taking your time tonight. Well, and there's some thanks popping up in the chat too, if you all want to read the chats. So Maria, should we ask for a motion to adjourn the meeting?
Let's give it a try this polling thing one more time. Okay.
Oh no.
Move to adjourn.
But it's okay that our panelists don't have to stick around to try voting on the chat. Thank you all and good night. Carnegie Parents, we will, let's see. The next PTO meeting will be in the third Thursday of the month. This month it was the fourth Thursday because last week was spring break. But it'll be the third Thursday of the month on Zoom, same times. And we do put the link out in public. It's always on the PTO calendar. But we kind of hide it on the calendar to defend ourselves a little bit from crashers. We hope that that's the happy medium between making sure the school community can find it and making sure that random whoever has a difficult time finding it. And the speaker we have lined up for next month is a man named Benjamin Holloway. Mr. Moss knows him. He used to be an English teacher at Carnegie, and he now does a college consulting business. So he will come and talk to us about what our kids need to be doing, and I think a general philosophy of applying to college, which I've heard him speak before, and I think it's valuable even to those of you who have freshmen and sophomores. Okay, Maria, just let us know when the poll is ready.
Do we have a motion? Do we need one?
Well, I guess I'll move to
moved.
do that.
Second, Susan,
Over
second.
in seconds.
All right. There's a motion to adjourn the meeting. Everyone who votes yay, press yes. Vote no or abstain. Who wants to go home? I'm guessing most people are at home. I'm the only one who's still at work.
Okay, and we've got 12 votes and 21 participants, and you and I can't vote, right? So
Correct.
63% voted. So that's pretty good.
I think we're getting better at it. All right. Motion passes.
Okay, I think with 13 of 17, we've at least got a majority vote now.
Thank you all so much.
Okay.
Thank you.
Mr. Moss, thank you for being here with us. We always appreciate your time.
My pleasure.
Well, have a good night, everybody. I think the motion to adjourn passes. We'll see everyone in mid-April. And good luck with everybody on their for your students on their upcoming exams.
Yes.
So have a good night.
Good night.